It's time for PetSylvania with Dr. Bob Esplin. Dr. Bob guides you through the latest veterinary techniques and procedures to keep your pets in the best of health. PetSylvania is brought to you by Elanco, maker of Trifexis and Comfortis. With your ears up and tails wagging, here is Dr. Bob.
Hello, pet lovers. Welcome to PetSylvania. It's Dr. Bob from Sylvania Vet. When I talk about my sponsors, they almost end up like infomercials. They're not these 30-second sound bites or minute sound bites you're used to listening to, and they certainly are nothing like the GoDaddy ad on the Super Bowl. As a result, I'm trying to give you a little education about these products that are my sponsor and about my practice, of course. So we'll start with Elanco, and they've been a sponsor since the very beginning. And the two products that we use a tremendous amount of are Trifexis and Comfortis. So if we start with Comfortis, Comfortis is the most advanced flea control that's out there. It's a once-a-month pill. Topical products seem to be becoming kind of like old news, and the oral approach is, less messy, less risky, no side effects, no concern about, getting it on the carpet, or your children touching the dog or cat. No, in reality, I don't think there's any risk, but there's a great number of people that just don't like that, and there's a great number of animals that don't seem to like to have it applied. My dog wants to turn itself inside out to keep me from putting it on there. So Comfortis has been great. So if you're only having a flea issue, particularly in cats, that might be a product of choice. But the real big dog that's come out in the last 2 years is Trifexis, and that's a combination product of a once-a-month heartworm medication that's present in a product that's been around a long time called Interceptor, and the Comfortis. So now what we're doing is we're treating or preventing, and the reason it's called Tri, 3 areas of parasites: fleas, heartworm, and internal parasites, roundworms, hookworms, and whipworms. The other thing I want to brag about, you don't have to believe me, you just can check around. We have by far the lowest prices in the area on both Comfortis and Trifexis, and we've found that some prices are literally 40% higher than ours. So check around and think and see that is Sylvania Vet a place that I'd like to become a client so that my dog or cat can become a patient, and then I can buy these products and get the benefit of reduced cost. Sylvania Vet, my office, it's a 24/7, 365 pet destination. We are the only practice in the area, only general practice in the area, with a 24/7 staff in the building. We have at least 2 people in the building all day, every day, including the holidays, and a doctor on call. And we don't have a doctor in the building, but they're on call, and they're all within 15 minutes. So if they have to come in, they will. They'll be there in the middle of the night if necessary. When I left the office today, went flying out, they were heading into surgery to do a C-section on a Leonberger. And so you've never probably heard of that breed of dog. It's a big furry dog. They're very cool. You'll have to Google it and see what they look like. But we're going to have, I suspect when I come in tomorrow, we're going to find that we have a litter of maybe 10 to 12 Leonberger puppies on the ground. That many puppies is difficult for most dogs to deliver. They just wear out and they get tired. From that standpoint, we think that really sets us apart, is that availability, the fact that we're open until 7 o'clock at night most nights of the week, that we're there until 5 for regular appointments on Saturday also means that you aren't having to pay emergency fees for a Saturday afternoon problem. And, our mission is high quality medicine, and our passion is customer service. You've got to really come in and take a tour, meet our people, and you'll be convinced that Sylvania Vet's the practice for you. Esplin Medical is a company that I'm involved in, hence the name, and we make a premium, environmentally friendly surgical scrub in various colors and various styles. It is like wearing pajamas. They are so soft. They are 80% all natural fiber, which means that they breathe, and they are just very, very comfortable. And so if you have to wear scrubs all day, this is really something that you want to try. Our 4 colors at this point are navy, seal blue, Caribbean blue, and jade green. There's also 4 styles that unisex, and then women's 4 pocket tops and contrasting tops enable us to provide, pretty much what any person might be looking for. They're available locally at Toledo Family Pharmacy. 2 locations, Cricket West in West Toledo and on Sylvania Avenue at Jackman. Both are great stores. They have the full line of product in both navy and Caribbean. Caribbean. We're going to have some opportunities, a great place to learn about more about it, maybe buy product if you don't want to head to those two locations, is online at www.esplinmedical.com. And you can order securely on there. Well, the most popular dog is year in, year out is a Labrador. There's variations in what's second, third, and fourth place, but the Labrador seems to still be the most popular dog. One of the points that I want to make is that most popular doesn't necessarily mean the best for everybody, and part of the problem when you've got a really popular breed is that there are a lot of people that breed their dog and think that they can make some money, and they're not putting anything into knowing that they're breeding healthy dogs and breeding dogs without congenital problems, and so it's if you see an ad in the paper for a Labrador for $300 or $400, I'd question that. That may not necessarily be what you really want to get. But the other things that you need to think about when you're thinking about getting that first dog is you got to think about the family dynamics. Do you have young children at home? Well, a Labrador with a lethal weapon tail may not necessarily be the right thing for a 2 or 3-year-old that's just learning to get up and toddle around and is about at eye level with that adult dog's tail. How much space do you have for a dog like a Lab? They take a lot of space. They need a ton of exercise. So that means how much time do you have to interact with your Labrador and go out and play fetch retrieve and do the things that come naturally to it, find a place for it to swim, do all those kinds of things. Is it a long-haired dog? Does it take grooming? All right. So what kind of grooming responsibilities are you going to have, and how many times are you going to have to take it into the groomer? What's the expense? Buying a large breed dog is going to cost more to maintain that dog through its lifetime than buying a small breed. Antibiotics are dosed by weight. Food is provided by the pound of the dog. So those are all things that you should really think about. And we offer a service where you can come in and you can pay an office call charge, and we'll sit down and we'll talk about all these issues and try to come up with a series of dogs that we think are good choices. And I would recommend that you go to the AKC website, and you can Google AKC and it'll come up, and you can learn about all the popular breeds and some of those that you never heard of, like a Leonberger. Playing with your cat is really important, and what we do is we encourage you to get with a kitten and start enriching its life right away with play and feathers on a stick and little foil balls that it can chase and bat around, and a laser pointer that you can take and you can kind of throw around and chase the kitty all over the house with the laser, chasing the laser light. But hide some treats and put them out, and then highlight the treat with the laser. The kitty pounces, gets that treat, gets rewarded, and as a result, it's going to want to do it again. So you can't just have it chase a light and keep its interest. I mean, we would all lose interest in that if there was no reward at the end. That's like playing tennis, and all you do is you go to the backboard and you hit balls back and forth to the backboard. And ultimately, that's not tennis, and that's not an awful lot of fun. There's a couple of ways you can learn more about enriching your cat and how to enjoy your cat and how your cat can enjoy being in the family, and that's Indoor Pet Initiative at the Ohio State. And so the email address for that is indoorpet.osu.edu. And then our cat seminar coming up this Thursday, February 21st at 7:30 at the office at Sylvania Vet. We're going to talk about enrichment among other things, and we're going to talk about diet. We're going to talk about health and vaccine issues. We're going to talk about the importance of being designated a cat-friendly practice, and we're going to have plenty of time for questions. And one of the points that we're going to talk about is that scruffing a kitty, grabbing them tight behind the nape of their neck for whatever reason, restraint or discipline, whatever it is, that's considered a no-no by cat authorities and is no longer a practice that, except in very extreme situations, that we do to pets that are in our care at Sylvania Vet. So we'll take a break, and then we'll be back. No matter how hard we try to treat pets' ears and the efforts that go into making the diagnosis as to why a dog or a cat, but mostly dogs, have really severe chronic ear problems. There comes a time in some animals when there's nothing more we can do, and the ear canal is literally calcified, closed, swollen, closed. It's painful continuously for the pet. It influences their attitude. It influences eating habits. If we were in chronic pain, we would be the same way. We would be grumpy. What do we do in a situation like that? Well, there is an ear canal procedure. There is a procedure called a TICA, which is a total ear canal ablation. Ablation means it's going away. And so this week I did a TICA on a little Shih Tzu who's had nothing but ear problems its entire life. And the interesting thing, it's only been one bad ear, and the other ear's held its own pretty well. This ear was shot. It actually was up at Michigan State about 3 months ago. They did a CAT scan, and they found that the middle ear and the area of the ear that we know as the mastoid was involved in this in a big way, and there was just a tremendous amount of pain. So I did a TICA on this little guy, and it was quite a challenge. We were working in a really small hole, still relatively deep. Got to think about how you're doing it. It's kind of like you're working down at the bottom of funnel and trying to work through that little tiny space. But we were able to really help this dog. Sent it home yesterday, doing well. We're going to see it tomorrow, and then we'll see it in about a week. But I'm really pleased with the way everything went. So that's something that you can, hopefully you never need it for your pet, but it is something that you may need to keep in mind, or if you have a friend who's in a situation like that. TICAs are done in many cases by specialists at about twice the fee that we charge for that. So I'm fairly confident that we can do that. We got a dog in the hospital right now getting a C-section, and so that seems really prudent. You got a pregnant dog. What can you expect at delivery? Well, many dogs will free whelp. That's what it's called, and you don't have to involve us. But sometimes they big litters. You need to be involved, or some breeds like bull mastiffs and English bulldogs, pugs, French bulldogs, they don't free whelp, don't have a big enough pelvic canal to allow those chunky heads that those breeds have to pass. And then some breeds inherently have what's known as uterine inertia, where the uterus just doesn't have the muscle strength to work and push a whole litter of puppies out. Things that you want to know is that, what do you do before if you've got a pregnant dog? Well, first off, let's talk about this. Let's not get a pregnant dog unless you're planning it. All right, get your dog spayed. There's no reason to not spay your dog if it's a mixed breed dog, if it's a pet. There's nothing to be gained by allowing it to have heat cycles. Spay your dog. But should a pregnancy happen, either be electively or by mistake, pregnant dog, and you didn't get the spay scheduled, then the next thing you do is you recognize, well, what do we do during that? And we start moving a dog over to puppy food, so that gives them extra vitamins and minerals during the pregnancy. Pregnancy in a dog is about 9 weeks, so we break it into trimesters, and so we begin puppy food at the beginning of the second trimester, and at that point we also begin to worm the dog every 2 weeks right through nursing. That'll help them. Along comes delivery, and how do you know when it's time? Well, one of the things is there's so much to know, and I can't really begin to tell you everything that you would need to know here. And so that's why we have a telephone, and we would encourage you to call us and ask some pointed questions. And better yet, we want to be involved during a pregnancy. I think we can do an ultrasound to diagnose the pregnancy. We can do an X-ray to count the puppies so you know what's coming, and that's useful information. And then we provide you with a tremendous amount of data and information on how to manage a litter of puppies once they hit the ground. You don't want to separate mother and puppies from your household until the puppies are a minimum of 7 weeks old, and it doesn't matter whether they're truly weaned and eating only puppy food or they're still nursing on mom. It has to do with socialization and a lot of other factors that keeping the litter together. You're having a healthier. You're sending off to new homes a healthier group of puppies. As we talk about spaying, and getting that dog spayed so we don't have that surprise litter, you might be interested to know that our exotic doctors have spayed an interesting array of animals. We actually did a C-section and then spayed an iguana. and who is in delivery difficulty. This month we've neutered a rabbit, and we spayed a rat, a pet rat. And I know people shake their head and just say, "What the heck is going on?" We've spayed and neutered bunnies. A male bunny left intact can be something of a chore to have in the house. They can get pretty aggressive and mark and things, and their urine gets very strong smelling, and so they may lose their happy home. But if you neuter them, that really mellows that out pretty nicely. The last appointment I had of the day before I came to do this show today was a dog that had come in to have its heart evaluated because it had a heart murmur. Many dogs, if they live old enough, will develop heart murmurs. That's just part of a dog getting older. Doesn't necessarily mean that it's anything bad. So if one of our doctors or any other veterinarian says, "Have you ever been told that your dog or your cat has a heart murmur?" and your answer is no, the reality is that that's not the beginning of the end. Dogs can live with an abnormal heart murmur for a really long time. If you bring in a puppy or a kitten and we're hearing a heart murmur, now we may have a congenital defect. That can actually be more serious. And so how do we help this situation? And one of the things that we do is that, we talk about the intensity of the murmur. It's just a sound. It's rated on 1 to 6. And it gives us the ability to talk from doctor to doctor about, I heard a dog that had a 2. Other doctor can get a mental picture of what I was hearing. Ultimately, in the older dog, that murmur can lead to heart enlargement, and then ultimately could lead to congestive heart failure. But there's no timeline on that. It can be weeks, months, or even a multiple number of years before the first time that murmur is heard till it ends a congenital defect. So X-rays become the most important part as we monitor the lung fields and we monitor the heart size. In a puppy or kitten that has a murmur, then we want an echocardiogram to identify what's causing the murmur. Is it a bad valve? It probably is, but which one? And each of the bad valves, whether it be a aortic stenosis or mitral insufficiency, those have different prognostic numbers associated with them. So we're going to refer that puppy with a murmur to the cardiologist before we take X-rays or anything, because those X-rays are probably going to be pretty normal. That's something I think that is really important. One of the most important things that we do, and this is nationally Pet Dental Month, and for us every month is Pet Dental Month, and so we don't make a big deal out of February because we make a big deal out of dental care every month of the year. We couldn't do any more than we're already doing in that regard. And one of the keys is that you should, anytime your pet goes into the veterinarian or the technician or both should be flipping the lip and looking at the teeth and looking at the gums. But who else can do it? Well, if you're boarding, the boarding staff can do it, and the groomer, if you're going to the groomer should do it. Our every one of our employees is trained to flip the lip and take a look every time we see that animal, and weighing that animal every time we see the animal is really good. So what's available in the way of dental care? But there are a lot of things available to you for dental care that I want to be able to pass on to you next week, and I'm going to run out of time here. So we're going to take a break. Well, I'm back to wrap it up. This time just flies by talking about this, and I really want to encourage you to send questions, and that, because that really makes this an interactive kind of show. So please take just a couple of minutes to send questions to request at WSYLradio.com, and then I'll answer them on the air, I promise. After the question I answered a couple of weeks ago, there's nothing off limits that I won't answer. One of the things that we deal with a lot in the white dogs, but sometimes in other dogs as well, it just isn't quite as pronounced, is the reddish brown tear stain that comes down from the corner of the eye along the nose. Over the years, people have asked me multiple questions. What can I do about this? And I've never had a great answer. I usually have suggested that you try wiping it with a little bit of peroxide and making sure you don't get it in the eyes. Turning it into a blonde has not really done it. There's some new product out out on the market. It comes in two forms, and it's called Tear Stain Formula, and it comes as a soft chew, so it's an oral, and it comes as a liquid wipe that you can wipe along the mess. I think that in all reality, you got to give them a try for about a month, but and we're just in the early stages of carrying this product. It looks like from reading the literature at least, it's been very effective, but we're going to have to form our own opinions. We'd love to have you, if you've got a Bichon or a white poodle or a German Shepherd that's got the white German Shepherd that's got tear staining, come in, buy some, and then give us a report back after a month. We'd sure appreciate that. Want to remind you of a couple of things that are going on at Sylvania Vet. Thursday of this week, on the 21st at Sylvania Vet at 7:30, we're having the cat seminar, and I highly encourage you to come. It's going to be great door prizes. We've got a raffle that's going to give away a $50 gift card to one lucky winner. So I think that'll be really useful for you. So I want to encourage you to do that. So I want to again take a minute here to thank my sponsors, Elanco, makers of Trifexis. Our price for 6 Trifexis tablets, 20 to 40 pounds, is $80.92. Take that number and go check it out with other practices. And buying it from the veterinarian is the only way you can buy this product. It's not allowed to be in the stores anywhere. SVH, the Sylvania Veterinary Hospital, affectionately known as Sylvania Vet, 4801 Holland, Sylvania at Haroon, just down the street from Flower Hospital. Phone is 419-885-4421. Our email is www.sylvaniavet.com. We encourage you to go there and use our library if your dog has been diagnosed or cat has been diagnosed with anything and you want information. The State Farm ad that involves the internet, and you can see this on YouTube, and you put in YouTube State Farm French model, and you will see this ad if you haven't seen it on TV. But basically, it says a young woman is saying that she heard that State Farm didn't have any apps, and she had learned that on the internet, and then she went on to say, well, anything on the internet has to be true. It's not allowed to be a lie. And then, here comes my date, and he's a French model, and he is really scruffy-looking guy. I mean, about the opposite of what a French model would be. So I really think I laugh at that because it's what we deal with every day. And then Esplin Medical Scrubs, www.esplinmedical.com. They're so comfortable they can be worn as PJs. I can personally tell you that my grandson got a pair. He never wore pajamas before. He will not sleep without wearing his Esplin Medical Scrubs. So maybe he's going to be a doctor when he's older. Who knows? Doi, a friend and a client, she bought a pair to just bang around in, and she loves them, and she loves the color, as quotation from her. She bought jade green, and it is a pretty beautiful color. So with that said, there's only one greatest pet, and it lives in your home.
You have been listening to PetSylvania with Dr. Bob Esplin on WSYLradio.com. PetSylvania is brought to you by Elanco, maker of Trifexis and Comfortis. Tune in every Saturday at 10 a.m. as Dr. Bob explains the latest in veterinary care and answers your questions. You can email your pet questions to requests@WSYLradio.com, and Dr. Bob will answer them on a future show.